There are many parts of a modern healthcare system, each of which collects and analyzes data. Healthcare providers and intermediaries such as health insurance companies, government programs such as Medicare and Medicaid generate huge amounts of data that patients can tell you something about the care that they receive, their health status, outcomes of their care, and the costs that are associated with that care. Almost all of these data are now in digital form and some of it usable for analysis through artificial intelligence. There are a wide range of applications in artificial intelligence to healthcare, including increasing the accuracy of diagnosis, robotic surgeries, identifying candidates for drug development, or determining the best treatments to use for specific patients. Like any tool or innovation, however, artificial intelligence raises ethical issues that could be considered by its developers and users and important stakeholders such as patients. I'll be highlighting aspects of the healthcare system that I think are important to think about if you are a user or developer of AI systems, and drawing attention to their ethical implications. I'll be focusing here on a particular subset of applications of artificial intelligence most related to financing and delivery of healthcare services. But what are the ethical issues? There are many. But broadly speaking, the questions we should ask are, first, whether artificial intelligence tools help or harm patients, their families and caregivers, or healthcare providers, and second, whether these tools are socially just or not. The ethical issues can arise from different aspects of AI, such as the nature of the data that are used, the way that data are collected, the way that AI models are designed, or how their output is interpreted and used. In addition, there can be broad social implications to the extent that AI systems are intended to replace humans at healthcare-related jobs. You might have heard about some of the general ethical concerns raised by artificial intelligence. A big concern is about the privacy and security of digital data, especially in the domain of healthcare, because healthcare data are sensitive. In addition, there are many laws and regulations specific to the use and transmission of healthcare data. Computer scientists and journalists have discovered ways that AI can lead to conclusions that are biased, that is, based on systematic error, because their models are trained on data that are unrepresentative of populations or features of interest. Systematic error in AI models is especially bad in the healthcare context, since output of these models can affect important and even life and death decisions. Sometimes these systematic errors can lead to unfair decisions, especially if they discriminate against whole categories of socially disadvantaged people, such as racial minorities, women, children, or people with low incomes. One type of ethical concern that is particularly relevant to AI is due to the lack of transparency of AI models. It's often difficult or even impossible to tell how AI arrives at its conclusions, especially if the AI uses machine learning techniques that mean that the models are constantly changing based on the data on which they're operating. This is of particular concern in the healthcare context because clinicians and healthcare organizations are reliant on AI developers to provide tools and technologies that are safe and effective to use on their patients. But currently, there are few standards or regulations for evaluating safety and effectiveness of many AI-based products used in healthcare. Yet, clinicians and healthcare providers are ethically and legally responsible for the decisions that are increasingly informed by AI. So it's critically important for clinicians and health systems that use AI in ways that can influence healthcare decisions to understand the limitations of the AI techniques, data, and models as they are applied to their specific patient populations. One type of ethical concern that we'll focus on in this course is the issue of conflicting or competing interests. This is an issue that arises particularly in the domain of healthcare.